Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Tina Haithcock. Tina is the manager of the Hamilton Medical Center's Cardiac Rehabilitation Program. The Cardiac Rehabilitation Program is located on the second floor of Bradley Wellness Center, 1225 Broderick Drive in Dalton, Georgia. Tina has a Bachelor of Science degree in Exercise Physiology from the University of Tennessee, Chattanooga, and is certified by the American College of Sports Medicine. Tina, thank you for joining us today.
I'm glad to be here.
I'm glad to see you. And, I have been through cardiac rehabilitation, and that's what we're going to talk about. Tell our listeners what exactly is cardiac rehabilitation.
Absolutely. Cardiac rehab is a medically supervised exercise program for any recovering heart patient. Each patient will be wearing an EKG monitoring device while he or she is exercising so that we can detect anything abnormal with the heart rhythm and heart rate during exercise. The patients will be exercising under the supervision and guidance of trained specialists who will be helping them the entire time and with their exercises, and will be checking their blood pressures before, during, and after exercise. We also send monthly reports to the patient's cardiologist just to keep them in the loop of their patient's health status. Some other great things I wanted to mention about cardiac rehab is that it is designed to help patients with heart disease recover faster from any heart procedure or heart event. It helps them return back to their normal activities that they enjoy, and it helps prevent another heart problem from occurring by lowering risk factors for heart disease, such as high blood pressure and weight gain. It helps increase endurance and strength, and it encourages patients to make healthy life changes by getting in an exercise routine and by learning how to eat healthier.
Tina, that is so much.
It is.
But it's all true, because I myself have been through cardiac rehabilitation, and all those things are so important to someone, not even someone who's had a heart attack, but somebody with heart disease.
Absolutely. And this just gets people back into a routine. Or if they've never been into a routine, it gets them into their own new routine. So our hope is that whenever they finish the program, they continue it,
right,
in some form or fashion, whether it's with us or on their own.
Now, who qualifies for cardiac rehabilitation?
It is recommended for those who've experienced any type of heart-related issue. I'll give you some examples. If you've had a heart attack or bypass surgery, if you've had a stent placement, valve repair, valve replacement, heart transplant, if you've had congestive heart failure, peripheral artery disease, or even stable angina, which is also known as chest pain during exertion.
I got you. Okay. Now, I did have that before my heart attack.
The chest pains?
I had some chest pain. But I just, I thought, this is just part of getting older.
And I've actually had a lot of patients say the exact same thing. But so what brought you to the doctor? What made you finally think, okay, I need to get this checked?
Well, I didn't.
Yeah.
I didn't go to the doctor. I thought it was a part of getting older. And then my story was it was on a Friday afternoon. I had a heart attack that afternoon and didn't know that I did. And then that night, it woke me up at about 1:30, and I was having severe pains. And I never should have driven myself to the hospital. And you folks that are listening, call 911.
Absolutely.
Don't drive yourself to the hospital. And I drove myself to the hospital. I got there, and I was having a heart attack when I got there, and they were able to work on me real quick.
Good.
And ended up with a 5-way bypass.
Wow.
But I went through cardiac rehabilitation just like what you're talking about.
That's great.
And I've been looking forward to having you on the show, Tina, because there's so many things that I wanted our listeners to know about how important that is.
And I appreciate that. You would think that this would be something that a lot of people would know about, but surprisingly, it's not. So I'm glad that we are making people aware and educating them about this program.
Yeah, I am too. And, the next question I have is, why would someone need cardiac rehabilitation?
That's a great question. Coming to cardiac rehab after any cardiac event is extremely important. Not only does it help individuals become healthier and stronger physically, but it also helps each individual regain their confidence back, that they can still have a good quality of life. A lot of our patients have expressed being nervous to work out on their own after having any type of heart issue, which is understandable. This program offers safety due to the fact that there is qualified specialists in the same room taking care of you every step of the way, and that your heart will be monitored the entire time you're exercising. Another important thing to share is that the cardiac rehab program has a social support atmosphere. That's probably one of my favorites. Not only do you receive emotional support from the staff, but you also get the social support from other patients in the class who've experienced the same type of heart issues. We want every person who comes to our program to feel welcomed and cared for. And personally, from my experience, seeing individuals feeling better physically as well as emotionally, and also maintaining health life choices is the best part of my job and my team's. You are not just a patient when you walk in our door. You are considered part of our cardiac rehab family.
I got you. That sounds very good. And you mentioned teams. Who's on the cardiac rehabilitation team?
So we got a big team. Our team consists of certified specialists, which includes a variety of physicians. So we have cardiologists, pulmonologists, and internal medicine doctors. We have a registered nurse, exercise physiologist, and a registered dietitian as part of our team.
Wow, that is a great team. I mean, you guys cover the whole spectrum.
Absolutely.
Yeah, you definitely do. Now, when patients, when they show up, they enter the program, what should they expect?
Great question. Each patient will have an initial interview with a cardiac rehab specialist who will carefully evaluate the patient's medical history and physical limitations, as well as the patient's health goals. The cardiac rehab team will then recommend an individualized exercise program for the patient based on the information given during the initial interview process. We offer nutritional counseling with our registered dietitian. You are welcome to bring your spouse or family member during this consult. I highly recommend that. You are offered one free cholesterol check, and we go over several educational topics such as heart disease and risk factors, stress management. We do things such as relaxation breathing and progressive relaxation techniques. We give several exercise tips and safety handouts, and also information on healthy shopping, cooking, and eating. And another thing that our patients have really enjoyed is we have cooking demo classes.
Wow.
I know
that is cool.
So much fun. And you could bring your spouse or any family member, and this is led by our registered dietitian.
Okay, good, because that's on your team.
Absolutely.
That's on your team. Now, how long does cardiac rehab usually last?
The program is 3 times a week for 12 weeks. Now, each class is scheduled for an hour. Now, that being said, because I know I have a lot of patients be like, I can't work out an hour. When you start the program, you will not be expected to exercise an entire hour. We start you off doing low intensity and short increments of time. We also allow as many rest breaks as you need. We want you to feel comfortable with what you are doing so that you will achieve the best possible outcomes. This program is a progressive program that gradually increases times and intensity when the patient is able to do so. And the classes are at designated times, but the staff will work as best as they can with your schedule. And this is my favorite part, but once you complete the entire program, we have a small graduation ceremony for you and present you with a t-shirt, a cookbook, and a graduation certificate. We make it a big deal because it is a big deal, and we're very proud of our graduates.
Well, you should be.
Absolutely.
You should be. Now, tell me about health insurance. Will health insurance cover this?
Absolutely, yes. Most insurance companies will provide coverage for the entire program, but if for some reason you have any issues with that or you don't have insurance, don't let that be a reason not to come. We do have financial assistance that is available if you qualify, and our staff can help get you set up with that.
Now, you talked about the ceremony at the end, but is there a continuation program with cardiac rehab available?
Yes, there is. We have a program, and it's called PrEP. It stands for Progressive Rehabilitative Exercise Program. That's why we call it PrEP. This is for our patients who complete the program and want to continue coming. So it's also for anyone who has special medical needs that can make exercise challenging on their own. So like chronic health conditions that qualify for PrEP program, just to have an idea, high blood pressure, if you have diabetes, or even an abnormal heart rate, if you've had congestive heart disease, or any other heart-related health issue. Now, something else important is we also have patients with lung issues that can come. So we don't want to leave them out. It's not just heart. We provide the lung patients with their own oxygen tank and nasal cannula, and we will check their oxygen saturation while they're exercising. This class, I also want to add, is open to any individual who has chronic health conditions that prevent them from wanting to go to a regular gym and who actually want the clinical supervision of a nurse and exercise physiologist.
Well, that is great. Now, you talked about the PrEP program.
Mm-hmm.
What does the PrEP program offer to a patient?
Oh, great question. The program consists of an individualized exercise program and health assessment. They can exercise up to 5 days a week in this particular program, so a little bit more than the other. We will check blood pressure, heart rate, and oxygen saturation. They're recorded each day. And that way, we do that so the patient's doctor can get a copy of this information when needed. We also offer health education, dietary consults, and a cholesterol check. And individuals in this program can also enjoy the cooking demo classes that I mentioned earlier, and also our balance and strength training classes. And they also have access to the Bradley Wellness Center's indoor walking track and their gym floor.
A few minutes ago, you talked about cardiac rehabilitation after surgery.
Mm-hmm.
But this PrEP program, is it also paid for by health insurance?
No, it's not. But, there is a small monthly fee for the PrEP program, just due to the fact that they're not on a heart monitor and there is no physician in that particular class is the reason why insurance won't pay.
Okay.
But again, like I said, the fee is small, and we could let you know, like if you call and inquire. But just to let you know, you still will have the same clinical staff to help take care of you in that class and to help you reach your health goals. And another bonus to this is we give a discounted rate for the spouses if they want to come also. To let you know, there's no contract when you join that particular program, and financial assistance also applies to those who qualify.
Well, that's great. Now, how can someone join the cardiac rehab PrEP program?
All they would need to do is have a doctor's referral sent to us to enter into the program. Once we receive a referral from their doctor, we will then call and schedule the initial interview assessment. Now, if you have not received a call from us, please contact us at 706-272-6574 to be able to set up an appointment with us. And we're happy to assist in any way that we can.
Tina, that's great. Thank you so much for sharing all this great information with us today.
Oh, no problem. It's my pleasure. Thank you for having me on your show.
It's great having you here. For more information on the Hamilton Cardiac Rehabilitation Program, visit hamiltonhealth.com/cardiac rehab, or you can call 706-272-6574. 706-272-6574. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your health care provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.